Hello, everybody, and welcome back to Black Health. I am your host, Dr. Michelle Kirwan Bythwood. I am a board certified pediatrician. And today we have on the show Dr. Stephen Hochwald. He is the director of the Mount Sinai Cancer Center and chief of surgical oncology. And we're going to be talking about gastric cancer today. Dr. Hochwald is a leading pancreatic and gastrointestinal surgical oncologist, an avid clinician and researcher. He has published extensively and led numerous research studies aimed at helping patients with complicated cancers. Welcome to Black Health, Dr. Hochwald. There you are. Welcome to Black Health. Thank you for joining us today.
Thank you for having me. I appreciate it.
Absolutely. I know your time is valuable. I know that you are out there saving lives on a daily basis, but it is my hope that with information and education that you impart today, that maybe we can save a life or change a life here on Black Health. So again, thank you for joining us, and we're going to jump right into it. My first question for you is, what is gastric cancer? How common is it? And is it an under-recognized cancer in the United States?
Well, gastric cancer is a abnormal proliferation of cells that happen in the stomach. So that can happen anywhere in the stomach, which is a relatively large organ. And this growth of cells can lead to tumor formation, and these tumors can be aggressive and spread and cause mortality related to their growth in patients, unfortunately.
Mhm.
The gastric cancer occurs in about 30,000 patients in the United States every year. The incidence rates actually have been declining slowly over time, but this still remains a persistent cancer and is associated with a high mortality rate.
As the director of Mount Sinai Cancer Center, are there any trends that you're currently seeing in gastric cancer diagnosis? Are patients being diagnosed earlier, later? What issues there concern you the most?
Yeah, the concern for gastric cancer is while the overall incidence has gone down a little bit over time, there is a concerning increased incidence happening in younger patients. The exact reasons for this is not 100% clear, but we think it's related to obesity, that there's an increase in obesity occurring in younger patients, and that obesity at a younger age puts people at increased risk for the development of some cancers, including gastric cancer. So we're seeing gastric cancer show up in patients in 40 years old or even younger, which is going up, increasing in incidence compared to years ago.
Right. So years ago, what was the age of diagnosis typically, or earliest age of diagnosis typically?
Well, it would be the average age would be about 65 to 70 years old would be the average age. And so that still remains approximately the average age, but it would be very rare to find it in someone who's as young as 40 years old. But now that incidence is going up slightly in the younger patients, that's the concerning part.
What are some of the important risk factors for gastric cancer that the public should know about or that might be overlooked? Obviously, obesity is one of them. Are there others?
A big one is having an infection in what's called H. pylori. H. pylori is a bacteria, and that bacteria can live in your stomach, and that bacteria causes inflammation in the stomach over time, and that can contribute. That's a big contributor to the development of gastric cancer. So having an unrecognized H. pylori infection is a big contributor. Smoking contributes to gastric cancer incidence, and so if you smoke, you have a higher chance of getting stomach cancer. I use stomach cancer and gastric cancer interchangeably because it's the same thing. And alcohol use. Alcohol use is there's now been shown there's sort of a dose-response relationship. The more you drink, the higher the incidence of certain cancers, including stomach cancer. And there's also
go ahead.
A relationship between genetics and stomach cancer. So you can inherit genetic factors that increase your risk of getting stomach cancer as well.
Going back to the H. pylori, I'm sure there's somebody watching now who has maybe a history of H. pylori. Does a history of H. pylori, treated H. pylori, increase your risk for gastric cancer, or is this unrecognized, untreated, prolonged H. pylori infection?
It's more commonly unrecognized, untreated H. pylori infection that can predispose someone to getting problems in the stomach. So H. pylori can cause ulcers in the stomach, and sometimes patients will have stomach pain, burning, bloating, discomfort, and that could lead to a diagnosis of H. pylori. But that H. pylori has to be looked for. You can find it, there is a breath test for it. You can look for H. pylori in the stool. There's even a blood test. So there's different ways you can diagnose H. pylori. But H. pylori infection for a long period of time is probably contributing to stomach cancer. You can treat H. pylori and get rid of it, and that should reduce your risk of getting stomach problems like ulcers or cancer in the stomach.
How about the social determinants of health, like income, education, housing, transportation, access to specialty care? How does that impact when gastric cancer is diagnosed, the quality of treatment patients receive, and ultimately their outcomes?
Sure. So, not having access to appropriate care or not having insurance has definitely been shown to affect the survival from cancer. And so, if you're having symptoms and you're, reluctant to get treatment because you have to pay out of pocket for treatment, that's going to delay your time to get an intervention. So that's a problem. So that's an issue. And then also having the not the right food sources can be a problem. So if you're living in an area where there's poverty and not having the right fresh foods, having more heavily processed foods. I forgot to mention that gastric cancer is also associated with eating certain foods, and that's having very salted or highly preserved foods. So really focusing on eating those kind of foods instead of more fresh foods is a problem, and that can increase your potential risk for stomach cancer. And then in certain neighborhoods with reduced socioeconomic status and poverty, that's been linked to higher rates of obesity, higher rates of alcohol use, and that could increase your risk of getting stomach cancer.
Are there populations, racial, ethnic, socioeconomic groups that are disproportionately affected by gastric cancer? And I would ask why, but I think you did give us some of the why there. But which populations?
Yeah, unfortunately, Black Americans have possibly as high as a twice the incidence rates of gastric cancer as white Americans do, and it's also increased in Hispanic, non-white. Hispanic populations. So that incidence is probably related to some of the social determinants of health, for sure. But also there is some complex interaction between the what you eat and your environmental factors and your genetics that may also be contributing to higher rates of and outcomes for gastric cancer in Black Americans.
What systemic changes do you think are needed to achieve health equity in gastric cancer and gastric cancer diagnosis, treatment?
Well, we have to try to do screening. I mean, we don't really have a screening program for gastric cancer in any populations in the United States. Part of this is because the incidence rates are, 30,000 cases a year in the United States is pretty high, but it's not as high as other cancers, for instance, to put it in perspective. For instance, colorectal cancer is maybe five times as prevalent as stomach cancer. So there's higher screening programs going on for colorectal cancer because you have about a 1 in 20 chance of getting colorectal cancer in your lifetime, while for gastric cancer, the chances are 1 in 100 or over 1 in 100 chance of getting stomach cancer. So screening is occurring for colorectal cancer, but not really for stomach cancer. But at the same time, there's populations at increased risk. So those are Black Americans living in certain areas or neighborhoods have shown to be at increased risk. So we could focus screening on specific populations, and that I think would be important to do. Sorry.
Dr. Hochwald, we do need to take a quick commercial break. You are watching Black Health. We are here with Dr. Stephen Hochwald, the director of Mount Sinai Cancer Center. We're talking about gastric cancer, gastric carcinoma, stomach cancer. We will be right back. Don't go anywhere.
February 19th to the 22nd. Join your favorite culinary stars at the Food Network South Beach Wine and Food Festival.
It's going to be amazing.
Don't miss out on the gastronomic extravaganza that's making waves.
If you haven't been, you are missing it.
Take part in masterclasses, tastings, exclusive events, and so much more. Proceeds benefit educational programs and scholarships at Florida International University.
And buy your tickets early because they're going to go quick.
Get your tickets now at SoBWFF.org.
To learn more about what we do, to get involved in our mission to help all of Broward's children learn, grow, and thrive, or to find a program or service for your children, visit us at cscbroward.org. The Children's Services Council of Broward County. Our focus is our children.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Perez Art Museum Miami celebrates the 13th anniversary of Art and Soul, an unforgettable night supporting the PAM Fund for Black Art. February 7th, 2026 at Perez Art Museum Miami, honoring cultural pioneer Fab Five Freddy. Cocktails and a curated dinner by Chef Raheem Seeley, an inspiring program led by MC Neki Mohan. Music by Deep Fried Funk and DJ Aya, all in support of Black art. Visit pam.org/ArtSoul 2026 to purchase tickets.
Welcome back to Black Health. We are talking about gastric cancer today, stomach cancer, with Dr. Stephen Hochwald of Mount Sinai Cancer Center. Dr. Hochwald, we were just discussing some of the diagnosis and treatment of gastric cancer. My question for you as a surgical oncologist, what makes gastric cancer especially challenging to diagnose and treat compared to other cancers, maybe pancreatic or esophageal, other GI cancers?
Yeah, well, gastric cancer tends to show up at an advanced stage, so patients don't have symptoms too early on in the disease process. So when patients have pain issues, which can be upper abdominal pain, can be a symptom of gastric cancer, but often the cancer is relatively advanced before that starts. So that's a problem. Patients can have some subtle signs like a bloating or feeling full easily, but those are a little bit subtle, and it's hard to, know if what's going on. So basically, people have to have a high index of suspicion and really try to get attention if there's a subtle but persistent change in how they feel. And unfortunately, gastric cancer presents at a pretty more advanced stage, so the cancer can have spread in many patients at the time where it's diagnosed. And that's, if the cancer is more advanced and has spread, then the chance of cure goes down. So that's the problem with stomach cancer. Pancreatic cancer, however, is even worse because pancreatic cancer presents at a more advanced stage, but esophageal cancer is a little bit similar to stomach cancer. But people with esophageal cancer have trouble with swallowing or may notice that there's a problem even a little bit earlier than people with gastric cancer. So gastric cancer remains a problem, and the survival of patients is not good, unfortunately. So when you're doing large operations on patients, you are worried about the healing rates and their ability to tolerate other treatments that might be important for their cancer. So by able to do this through smaller incisions, patients can recuperate more quickly, and often other treatments are necessary, and they can get to those treatments.
I'm going to switch gears a little bit now. Can you tell us a little bit about the gastric cancer research study that you're leading with the University of Florida, funded by the Florida Department of Health? Can you talk a little bit about that?
Yeah, so what we did is we looked at the different areas in Florida, and we noted that certain counties in Florida have higher incidence rates of for gastric cancer. And so based on that information and based on the fact that it's been shown that there are national guidelines that doctors are supposed to follow in order to treat the patients with gastric cancer. And those guidelines are not being followed in more than half of the patients. So more than half the patients are not getting the national guideline driven care for their patients with stomach cancer. There's lots of reasons for that. Could be access to care, could be patients are underinsured, unfortunately. It could be that the doctors are not referring the patients to the appropriate specialists. So there's lots of potential reasons. So we hypothesize that getting a navigation program so that we can help direct patients based on the stage of their cancer to the appropriate guideline-driven care would improve the quality of their care, improve their outcomes from their gastric cancer. So that's what this study is about. It's about getting patients guideline-driven care and hopefully improving the outcomes from their stomach cancer.
What inspired you to focus on patient navigation rather than clinical or pharmaceutical intervention?
Well, it's a relatively simple, low-cost method that we feel can make a potential large impact in patients. A lot of pharmaceutical interventions unfortunately fail because most new drugs are not as good as we think they are, and so they fail in clinical trials. So this is not testing a new drug, but it's trying to attack areas where gastric cancer incidence rates are the highest, and trying to use a low-cost intervention by patient navigation, so we can help improve the education and we can help get patients to the appropriate experts so that they can improve their outcomes. Often patients in underserved areas are not able to even participate in these pharmaceutical studies. And so we hope that we can target those underserved populations and provide care through this navigation.
You mentioned when you started talking about the study, areas of Florida that had higher rates of gastric cancer. What areas were the highest? I'm just curious.
Putnam and Columbia counties are among some of the rural counties that have the higher incidence rates of gastric cancer. So some of it is in rural counties in Florida, but then the highest numbers are also in some of the South Florida areas, such as Broward County and Miami-Dade County. Some of that certainly is related to larger Hispanic communities that are in those areas, or even the Caribbean populations that are there. So there's a mixture of some rural counties and then also some in urban areas as well.
So your research is patient navigation. Are there gaps in research in other areas, clinical or pharmaceutical intervention?
Yeah, I mean, there's definitely a lot of gaps. I mean, we have gastric cancer treatments available for what we call the first line treatment, the treatment that should occur first. And if patients are not responding or failing the first line treatment, then they should get second line and third line. Sometimes these second line and third line treatments are not being given. And so there's definitely poor awareness and access to the second and third line treatments that are going on out there. There's also access to special biomarker testing. So we need to test the cancer for certain biomarkers, which may make the patients eligible for these targeted, what we call molecular targeted or precision medicine. And that's not occurring in some community settings. There's an inconsistent use of multidisciplinary tumor boards to help manage patients. There's lots of issues, underrepresented minorities and other diverse groups in clinical trials going on.
Yeah, that's in all areas, I think, historically. Yeah. We do need to take another quick commercial break. You're watching Black Health. We are with Dr. Stephen Hochwald discussing gastric cancer. We'll be right back.
February 19th to the 22nd. Join your favorite culinary stars at the Food Network South Beach Wine and Food Festival.
It's going to be amazing.
Don't miss out on the gastronomic extravaganza that's making waves.
If you haven't been, you are missing it.
Take part in masterclasses, tastings, exclusive events, and so much more. Proceeds benefit educational programs and scholarships at Florida International University.
And buy your tickets early because they're going to go quick.
Get your tickets now at SoBWFF.org.
To learn more about what we do, to get involved in our mission to help all of Broward's children learn, grow, and thrive, or to find a program or service for your children, visit us at cscbroward.org. The Children's Services Council of Broward County. Our focus is our children.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Perez Art Museum Miami celebrates the 13th anniversary of Art and Soul, an unforgettable night supporting the PAM Fund for Black Art. February 7, 2026 at Perez Art Museum Miami, honoring cultural pioneer Fab Five Freddy. Cocktails and a curated dinner by Chef Raheem Seeley, an inspiring program led by MC Neki Mohan. Music by Deep Fried Funk and DJ Aya, all in support of Black art. Visit pam.org/ArtSoul 2026 to purchase tickets.
Welcome back. You're watching Black Health. We are talking about gastric cancer. Dr. Hochwald, why is a multidisciplinary team like gastroenterologists, surgeons, oncologists, social workers, dietitians, why is that important for survival and quality of life for patients, especially critical for gastric cancer patients?
Well, we talked about how, unfortunately, patients with gastric cancer tend to have more advanced disease than some other cancers. So with advanced disease, you need to have multiple treatment options and regimens available, not just surgery, but you need to be able to deliver chemotherapy to help reduce or shrink tumors down so that surgery can be more effective. You might occasionally need radiation therapy. You need to understand the pathology and use the appropriate biomarkers to get the precision medicine or targeted drugs for these patients. So there's a lot of different experts that need to weigh in to make all the options available for treatment of patients. So this involves getting a group together. We call this a tumor board, getting everyone's opinion so that not one physician is making a decision on their own, but we're getting a group opinion because multiple minds are better than one to get the best outcome. best outcome for the patient.
Absolutely. If the results of your study are successful, can that model be scaled across Florida or even nationally?
Well, yeah, scaling will involve getting navigators on board to help guide and educate and steer patients towards better care. So in lots of programs, navigators aren't some health systems and communities don't have navigators because who's going to pay for these things? So we need to get reimbursements available for the use of navigation. So there has to be sustainable funding for a navigation program. I think that's important. We need to integrate the technology to track data for patients getting treated in rural communities. So this involves, getting the healthcare systems and different electronic health records to talk to each other better so that we can track patients. That's important. And then we need to basically embed navigation into standard care. So we need to make that, sort of a policy that we're going to do that as time goes on. So I think those are important issues.
We need to wrap up. Final question in 30 seconds or less. If there's one message you want patients, families, clinicians to walk away with regarding gastric cancer and research participation, what would that be?
Well, I think as the patients need to really advocate for themselves and their family members. And so we need to push the physicians to enroll patients into some research programs. These research programs are, in fact, trying to make a difference, trying to improve care. So I think patients should not be afraid of participating in the appropriate, research programs. And sometimes physicians are not referring patients. We have trouble with our simple study getting patients enrolled in our study because physicians might feel that they're losing control of their patients. So we need patients and advocates to push even physicians to get their patients enrolled in some of these simple studies that we think can help them. So it really takes a team of the community and community of physicians as well to really improve the care of patients with complicated diseases like gastric cancer. So that's what we have to advocate for.
Thank you so much, Dr. Hochwald. It's been a pleasure speaking with you. You're a wealth of information. Thank you for bringing your knowledge here to Black Health and helping educate the community. Thank you so much for your time. I know your time is valuable. I know you have a lot. I'm sure you're going to a busy office day or surgical day once you leave here. So thank you so much for being a part of Black Health.
Thank you, and I enjoyed the conversations. Thank you very much.
And for those of you watching, thank you, and we'll see you next time on Black Health. Have a great day, everybody.